Welcome, everybody. Good morning. It's my privilege to introduce Dr. Jennifer Reinert, who is a 2018 graduate of Ashford. She completed under the Rockies umbrella with a PsyD in health and wellness psychology. She's an honorary graduate and member of the Golden Honor Society. Her focus is on plant-based medicine, and her applied doctoral project is titled The Experiences of Physicians Who Implement a Whole Food Plant-Based Diet as a Treatment Modality for Chronic Disease. I have the privilege of serving on her committee and watching her progress. And so it's exciting to have Jennifer here and to share this important research. Just a little bit more about her background is she's also a certified holistic health coach from the Integrative Institute of Nutrition, has published several articles on nutrition, including in the Canadian journal titled Mission Moringa, the Miracle Tree and Its Healing Properties. And she works full-time in corporate sales for Vi Living, a continuing care retirement company. And she's passionate about her 3 children, 21, 19, and 15. And during her free time, travels, works out, and continues researching plant-based medicine. With that, Dr. Reinert, take it away.
Great, thank you, Dr. Burris. I'm excited to be here today and being able to present my research. One of the exciting pieces for me is that I've actually had a few physicians since I've published my research reach out to me looking for further information in this field. So it's definitely something I think that a lot of physicians are looking for. So really excited to be here today and be able to share the information that I discovered during my dissertation applied doctorate project. So again, my applied doctorate project is the experiences of the physicians who implement a whole food plant-based diet as treatment modality for chronic disease. And on my team, I had Dr. Heather Frederick as my chair, Dr. Melanie Shaw, and Dr. Scott Burris as my committee members. So just to give you a brief outline of my study, my study outline is the background of the study, the purpose, I have the questions, conceptual framework, the review of relevant literature, overview of the population, the data collection analysis, and the themes that I discovered during my project, and then it will end with my findings. So just a little bit on the background of the study. As most of us know, especially watching the news these days, the prevalence of chronic disease is growing in our country. In the United States is definitely becoming one of the most preventable and affordable ways to reduce chronic disease is through a natural whole food plant-based diet. This has actually been used across the world to prevent diseases in other countries for thousands of years. There is much evidence being presented on these benefits of eating a whole food plant-based diet. However, there still remains a large gap between promoting this type of health and nutrition in the medical community. So my focus in my project examined the experiences of physicians who actually are currently practicing and implementing this type of plant-based diet as treatment modality for chronic disease for their patient population. And with that being said, they will use medications when necessary, but their first line of treatment is a plant food diet. So I have some research questions that I proposed to address the challenges, barriers, and successes with these physicians that are using this type of diet with their chronic patients as treatment. My applied doctorate project was a case study methodology using one-on-one interviews, which I focused on open-ended questions examining the experiences of these physicians. When I started my project, I actually sought out to interview 10 physicians, but I did reach saturation, which actually was pretty exciting, with 7 physicians. When I say exciting, it was just because a lot of the same recurring answers and responses were coming about with each physician, which really made a stronger case for my presentation. So let's move next to some of these important pieces here on the background of the study. So looking at the background of the study, one really large study, which is probably one of the largest that was done at the time of this study, and I know there's many more to follow, was the Kaiser Permanente 2013 health study. So Kaiser Permanente is the largest health maintenance organization, which is known as an HMO in the United States. They have 182,000 employees, including 17,000 physicians. So they took a very bold stance on just the importance of recommending the whole food plant-based diet. So with their study, with their 182,000 employees, they really took a look at specific problems and addressed the role of physicians emphasizing this type of study. So there's actually a couple of journal articles written by the Kaiser Permanente study recommending that physicians should consider plant-based diets, and throughout their studies, what they were portraying was that most individuals rely on media and their physicians to obtain their information, how to deal with their health concerns. However, when you really look at it, medical doctors are receiving as little as 20 hours of training on nutrition. So there is definitely a large lack of public awareness on using natural alternative or diet as treatment. The next part of my study, the purpose of the study was really just to look at the major disconnect between the research and the evidence, to bring awareness to the physicians and other organizations that are helping patients with chronic disease, and also to be able to contribute to the awareness of social change. So I'm not going to read through all of my questions at this time, but if you look below, these are my project questions and sub-questions. And just to recap briefly, what I was really looking and aiming to achieve was to really talk to these physicians and find out what influences have motivated them to change from a conventional medical practice to recommending a plant-based diet. What were the successes that they had with their patients? What were the patients' perceptions? We're going to look further in this presentation here at just the health belief model and how that it was incorporated into these questions. So looking at my conceptual framework, so the reason for conceptualizing the link between diet and the factors that affect an individual's health was to provide insight on how these physicians recommend a whole food plant-based diet, how they can prevent or improve their chronic patients' pain. So for this study, I did choose the health belief model, and this was to serve as an investigative roadmap to examine the proposed research. So just a little brief background on the health belief model. During the 1950s, this was created by a group of psychologists, and 20 years later, during the 1970s, was really started to be used and related to developing health-promoting disease prevention programs. So today, these the main basis of the health belief model is still, really integrated into using plant food diet with healthcare professionals and their ability to influence their patients, their attitudes in healthcare. So briefly, the four key concepts that I identified in the health belief model are the perceived susceptibility, perceived severity of diagnosis, perceived benefits, and perceived barriers. So when we take a look at that quickly here, the perceived susceptibility is explained as the motivating factor in which a patient is motivated to change their behavior and their health due to how they feel about how significant their medical condition is. So when you think about it, somebody's given a diagnosis, just depending on what they know about that diagnosis already and how severe they feel it is how likely they are to take the recommendations given by their physician and to make those changes. And then when we look at, the severity and then also the barriers that patients feel at the time of diagnosis, these are the key concepts that are used for physicians to help make those changes. So for example, when I did my research and the physicians listed the different barriers, that was, the main approach that they used to be able to make those changes with their patients. So during my research, although the experiences of each physician varied, and let's move on here to the next slide. I just skipped over the slide here. So this was the different literature that I looked at. So if you take a look here, there were different categories based on diets and integrated approaches that have been taken. And I also did look at certain studies that have already been done in this field. So as we fast forward, so looking at 10 medical physicians, which again were 7, I only focused on the United States, taking a look at only those physicians that are currently practicing now in a private practice, and they had to be currently prescribing a whole food plant-based diet. So with my study, again, it was a one-on-one research. I recorded the phone interviews in a semi-structured interview case study, taking notes. And then, again, I sent out letters of informed consents using data analysis, and my results were recorded into themes. So moving on to my recorded themes during my findings and evaluation. So here we have my themes based on the transcribes interviews. So let me back up here. So although the experiences of these physicians varied, common themes were seen among all the participants that I interviewed. So it was very exciting, several themes that emerged throughout the data. So these themes helped articulate the understanding of their experiences and why they recommend this type of diet. So the themes are as follows: nutrition education, and that really takes a look at how many hours were required in medical school, and the different types of alternative nutrition education that is available at this time for medical students. Also, the next theme was the discovery process. So this was the process of interviewing patients on their desire to change diet and behavior, and I'll dive a little bit deeper into that in just a minute. So again, the severity of diagnosis, which was the health belief model, to really understand how eager someone was to adopt a whole food plant-based diet depending on their actual diagnosis. Another really big key finding was cultural demographics. So when we take a look at the United States and the different areas, and really looking at the ease or the challenges that physicians have in the United States based on their geographic location. So for example, I'm here in Chicago, and looking at interviewing a physician that might be somewhere on a farmland where there's a little bit more accessibility to fresh foods versus, being in a city where they're going into grocery stores. I mean, these were all things that really play a part into different physicians. For instance, a physician down in the South stated that just the patients that they represent, the way they've grown up, or their backgrounds, from a cultural perspective, really made it difficult to get someone to change their diet based on what they were used to or have grown up with. So, that was another big piece of my study. Spousal resistance, which we'll also touch upon in a minute, and just someone's willingness to change based on their relationship with their spouse and how on board the spouse is with that. And then prescribing diet, so just a protocol that a physician's using, and what their action plan is, and how that translates into how well someone is actually going to adopt a diet. So we all know, going to a doctor's office, if someone has a physician that says, I think you need to change your diet, versus giving an entire plan that's already outlined for them, could potentially make the difference of how successful someone is. And then I also looked at a theme of solutions for the future, and just the commonality that the physicians that I interviewed with spoke about what they feel is really important as a whole to be able to really address the problem of disease in our country, by taking these solutions to the next step and bringing them to a broader perspective of physicians in our country. So just going over some of these findings. So just when we want to take a look again at nutrition education, Overwhelming 100% of every physician that I interviewed gave the same answer, that when I asked them about how their career evolved and what were their experiences to lead them to this type of practice, every one of them had a story to tell about something in their past, whether it be family, a particular diagnosis, or something that's basically scared them or prompted them to decide to change the conventional model that they had already started in. So they had all been conventional medical practitioners before getting into a whole food plant-based diet. So for instance, if someone had a grandmother or grandfather or cousin that had a diagnosis that prompted them to realize they needed to make a life change, and sometimes it might just be their own personal experience being given that diagnosis. So again, 100% of them said that based on nutrition education, that they actually came across changing their practice based on what they learned on their own outside of medical school. So although they were given a very minimal amount of hours in medical school, most of them said that it was learning more about the different properties that make up supplements, or the basic FDA given guidelines for how to eat properly. The majority of these participants all enrolled in another outside certification program. T. Collins Campbell Institute offers a certification, and that seemed to be a popular one for most physicians that are enrolling now into a program, is that particular education. But there were a few others, as well as every one of them had read the China study, has watched Forks Over Knives, has found their information other means than medical school. So the discovery process actually was a very interesting piece to my project. So being in sales myself, working with seniors in sales, this really hit home for me because, one of the big key factors in changing someone's diet was the interview process, which is something that I use quite often, but it's really digging down into someone's motivation for wanting to make those changes, versus just having a patient come in and giving them a prescription for a diet. It's really understanding their motives for changing. So it's kind of building that trust and that relationship with the patient and how to make those changes from there. So again, we already kind of really touched upon the severity of diagnosis and that relationship, but that was definitely a theme that came across, interviewing several different physicians from different areas of practice, from cardiology to oncology. That theme really evolved throughout my studies. It was just that difference of severity of diagnosis. And we just spoke about cultural demographics, which was one. And then I just want to turn real quick here to the spousal resistance. So the exciting piece for me, when anyone's starting a study, is just to really go in with an open mind, and then to end your research and finding that one key component that was a surprise to you. So thinking about my own personal life and other people's lives, spousal resistance can definitely have an impact, on whether people make those changes or not. But to see that every single physician said that that was their number one challenge with their patients was spousal resistance, and really kind of focusing on what can we do differently to change that. So whether it be physicians saying that they would invite a spouse in for the actual, prescription when they would talk about how to make those changes, or to look at, why the spouse is being resistant, but their actual patient said, you can give me a diet, doctor, but if I go home and my, husband or wife is not on board with this and is going to serve something else for dinner, I'm going to have a really hard time following that. So, really kind of taking these different themes and being able to translate these into future findings and recommendations, that I would have to say was the key of my entire research. So prescribing diets, that's pretty basic, just on what the action plan is, and how in depth the physicians are going with, the next steps for change. And then solutions for the future, that was another really interesting piece that I came across, with the doctors. All of them really did touch upon how they felt they weren't being given enough hours in medical school to learn these type of things or to feel comfortable. So I did have a few physicians that are actually currently practicing this type of plant-based diet, but they're not necessarily comfortable with prescribing it or if they're doing it the right way, even though they are doing the best they can to, to use this in their practice, but they would love for some more information to come out and some more education. So kind of looking here at time, we're just going to quickly go through, key findings, which you can find in my research. But again, it's just on the different procedures that we just touch upon on the themes. And I do elaborate in my research just on how to use those counseling strategies, how to use health histories. And as you can look at the different levels here, just all the things I touched upon there on my theme. And these are just some recommendations that I do come to at the end of my paper here. But when you take a look at these, a lot of these have, a lot of people in the United States have already heard of, maybe not necessarily looked at, but they are becoming more popular. And these, I actually put together this list based on the physicians that I interviewed. These were not pieces that they necessarily wrote, but pieces that they recommend. So documentaries they've watched, books they've read, apps that they use with their patients. I know a few of these said that they keep these books on their shelves and these, documentaries on their shelves so that if they do have a patient come in, they have a piece of material to hand them. So those were some of the recommendations. Again, recommendations for the future, just taking an in-depth study on physicians' lifestyle. So I truly believe after doing this research that, if a physician is practicing a healthy lifestyle, as all of them said that something made them change to doing this, to really take a look at what that is in order for them to be able to recommend and be more believable for their patients, to build surveys just to see how we can better help understand this. Motivational techniques that can be used is something I'd like to look to in the future. And there is a lot of promising future clinical research in this area coming about. So really kind of taking a look at all the new and upcoming information, even since I've completed my paper a few months ago, it's just rapidly changing. So I want to thank everyone for taking the time to allow me to present my research today. If you have any questions now for me, otherwise I am more than happy to take your answers via email and cell phone, which I've provided below. So
Great, thank you, Jennifer. That was a great presentation. I think the topic is really relevant to issues that we're facing today. I think you have interesting findings and practical applications. So I think you've really demonstrated how these applied doctoral projects can really have relevancy to the field. And we do have some comments and questions in the chat. The first, we have somebody from Accra, Ghana, who says they use moringa to fight so many diseases, including type 2. And I've been hearing more and more about that as well. And Dr. Sundstrom has a question. It's interesting. I actually had the same thought when you were presenting that Peggy has, which she says, I'm wondering if you found the concept of food deserts to be relevant in both physician support for and patients' acceptance of a prescribed diet.
Oh, I'm sorry, food, I didn't hear what that was.
Food deserts.
Yes, absolutely. And I have to say, like my actual presentation, I'm sorry, my research with the physicians, we didn't really touch upon the actual foods themselves. It was just more the broader theme of, recommending. But I know just my own passion and looking outside of that definitely was an area of future focus.
I believe Dr. Frederick, if I'm not mistaken, is working with another student right now who's doing some research on food deserts. And I would, suspect that, especially with that, urban, rural, and depending on how, what the urban environment is, that could be something that could be interesting to further explore.
Absolutely.
I think it's just something we're starting to even understand a little bit, the concept of food deserts. So another comment, somebody, sort of reinforces the notion of spousal resistance. And that, that can be relevant to a lot of fields, including family counseling. There's another comment here. Somebody, says that, two of my friends want me to see what the health, and I'm not motivated to do so, laugh out loud. I'm just going to follow everything in moderation diet. And I think what's interesting about that, and I'd be curious about, what you found, but, I think, the more sort of chronic or serious the disease, it seems, the more deep the intervention needs to go.
Absolutely, Dr. Burris, and that's my next steps with this. I'm really excited to be able to take my research a step further, potentially looking to write, a published book on this information, but just taking, these areas of spousal reviews, spousal resistance and demographics. So, that's just one area of particular interest, just because even in my own job, my career, which is, not based in food and diet, but just based in senior living, which, the wellness concept is there. And, I work across the country from California to Florida, and there's such a difference in demographics and the way that you're able to present and work with different clientele, especially when you don't have that severity of diagnosis, which I think has been key for these physicians to make those changes. But when you're just working with patients that come in and they're already healthy and don't see the need to make those changes maybe for future, I feel that it's not a one size fits all necessarily. So, as one area of the country may be much further along, and we even look at this with food disparity and, incomes, just, with folks that don't have enough money maybe to particularly purchase the organic foods, just kind of taking a look at, if there's different recommendations for different areas, or if there's something that really appeals to everybody across the board. And a lot of times it's even just getting that education out there and helping different areas understand, even though they may not have that diagnosis, I'm sure somebody they know does. So kind of really looking at those areas.